Hi everyone, welcome to this video on vaginal odor. In this video, we will discuss the symptoms of vaginal odor, how it is diagnosed, and the available treatments. What is vaginal odor? Vaginal odor refers to any scent that comes from the vagina. Every woman has her own unique scent, which can vary depending on factors such as menstrual cycle, hygiene habits, diet, and sexual activity. However, if the odor becomes particularly strong or unpleasant, it may be a sign of an underlying problem. A strong, fishy odor may be a symptom of bacterial vaginosis, a common vaginal infection caused by an overgrowth of harmful bacteria. Other possible causes of abnormal vaginal odor include yeast infections, sexually transmitted infections, STIs, poor hygiene, menopause, and certain medications. If you notice an unusual vaginal odor, it's important to see a healthcare provider for diagnosis and treatment. They can help identify the underlying cause and recommend appropriate treatment, such as antibiotics for bacterial vaginosis or antifungal medication for yeast infections. Maintaining good hygiene habits, such as washing the genital area with gentle soap and water, can also help prevent odor and maintain vaginal health. How many types of vaginal odor? There are different types of vaginal odor that a woman may experience, and they can vary depending on the underlying cause. Here are some of the common types of vaginal odor. Fishy odor. A strong, fishy odor is often a sign of bacterial vaginosis, an infection caused by an imbalance of bacteria in the vagina. Yeasty odor. A yeasty or bread-like odor may indicate a yeast infection, which occurs when there is an overgrowth of yeast in the vagina. Ammonia-like odor. An ammonia-like odor may be a sign of dehydration or a bacterial infection. Metallic odor. A metallic odor may be due to menstrual blood or certain medications, such as metronidazole. Sweet odor. A sweet or fruity odor may be a sign of uncontrolled diabetes, as high levels of sugar in the urine can create a sweet smell. It's important to note that every woman's vaginal odor can be different, and what is considered normal can vary. If you notice a change in your vaginal odor or a persistent odor that is strong or unpleasant, it's important to see a healthcare provider for evaluation. Fishy vaginal odor. A strong, fishy odor coming from the vagina is a common symptom of bacterial vaginosis (BV). BV is a condition where there is an overgrowth of bacteria in the vagina, which can cause a disruption in the normal balance of bacteria. This can lead to an unpleasant odor, along with other symptoms such as itching, burning, and discharge. BV is not usually serious, but it can increase a woman's risk of developing other infections, such as sexually transmitted infections (STIs). Therefore, it is important to see a healthcare provider for diagnosis and treatment if you suspect you may have BV. Treatment for BV typically involves antibiotics, such as metronidazole or clindamycin. These medications can be taken orally or applied directly to the vagina as a gel or cream. In addition to medication, there are also some steps you can take to help prevent BV from recurring, such as practicing good hygiene, avoiding douching, and wearing cotton underwear. If you are experiencing a fishy odor or any other unusual vaginal odor, it is important to see a healthcare provider for evaluation and treatment. They can help determine the underlying cause and provide appropriate care to help restore your vaginal health. What causes vaginal odor? There are many potential causes of vaginal odor, which can vary depending on the individual and their health status. Here are some of the common causes of vaginal odor. Bacterial vaginosis. An overgrowth of harmful bacteria in the vagina can cause a fishy odor, along with other symptoms such as itching, burning, and discharge. Yeast infections. An overgrowth of yeast in the vagina can cause a yeasty or bread-like odor, along with itching, burning, and thick white discharge. Poor hygiene. Not washing the genital area regularly or wearing tight clothing that doesn't allow for proper ventilation can lead to bacterial growth and unpleasant odor. Menstruation. Menstrual blood can cause a metallic odor, which is usually temporary. Sexual activity. Semen and other bodily fluids can mix with vaginal secretions and cause a temporary change in odor. Certain medications. Certain medications, such as antibiotics, can disrupt the natural balance of bacteria in the vagina and lead to a change in odor. Certain medical conditions. Conditions such as diabetes, hormonal imbalances, and sexually transmitted infections (STIs) can also cause changes in vaginal odor. If you are experiencing a change in vaginal odor, it is important to see a healthcare provider for evaluation and treatment. They can help determine the underlying cause and provide appropriate care to help restore your vaginal health. What are the symptoms of vaginal odor? The main symptom of vaginal odor is an unpleasant scent coming from the vagina. However, there may be other accompanying symptoms that can provide additional clues about the underlying cause. Here are some of the common symptoms of vaginal odor. Strong, unpleasant odor. A strong, fishy, yeasty, or otherwise unpleasant odor coming from the vagina is the main symptom of vaginal odor. Discharge. Depending on the underlying cause, there may be an accompanying change in vaginal discharge. BV, for example, can cause thin, grayish-white discharge, while yeast infections can cause thick, white discharge. Itching or burning. Some causes of vaginal odor, such as yeast infections and bacterial vaginosis, can cause itching or burning sensations in the vagina. Pain during sex or urination. In some cases, vaginal odor may be accompanied by pain during sex or urination, which can be a sign of an underlying infection or inflammation. Redness or swelling. Inflammation or irritation of the vaginal tissue can cause redness, swelling, or tenderness in the genital area. If you are experiencing any of these symptoms, it is important to see a healthcare provider for evaluation and treatment. They can help determine the underlying cause of your symptoms and provide appropriate care to help restore your vaginal health. How to get rid of vaginal odor. The treatment for vaginal odor depends on the underlying cause. Here are some general steps you can take to help reduce or eliminate vaginal odor. Practice good hygiene. It is important to keep the genital area clean and dry to prevent the growth of bacteria. Avoid using scented soaps or douches, which can disrupt the natural balance of bacteria in the vagina. Wear breathable clothing. Avoid tight-fitting clothing or synthetic fabrics that can trap moisture and create a breeding ground for bacteria. Use probiotics. Probiotics can help promote the growth of healthy bacteria in the vagina, which can help prevent infections and reduce odor. Stay hydrated. Drinking plenty of water can help flush out toxins and prevent dehydration, which can contribute to vaginal odor. Treat underlying infections. If your vaginal odor is due to an infection, such as bacterial vaginosis or a yeast infection, your healthcare provider may prescribe antibiotics or antifungal medications to help treat the infection. It is important to note that if you are experiencing persistent or severe vaginal odor, it is important to see a healthcare provider for evaluation and treatment. They can help determine the underlying cause of your symptoms and provide appropriate care to help restore your vaginal health. When will you see a doctor? Vaginal odor. You should see a healthcare provider if you experience persistent or severe vaginal odor, as this can be a sign of an underlying infection or other medical condition. Additionally, you should seek medical attention if you experience any of the following symptoms along with vaginal odor. Abnormal discharge. If you notice a change in your vaginal discharge, such as an increase in amount, a change in color or consistency, or a foul smell, it may be a sign of an infection or other medical condition. Pain or discomfort. If you experience pain or discomfort during sex, urination, or other activities, it may be a sign of an infection or other medical condition. Itching or irritation. If you experience itching, burning, or other forms of irritation in or around the vaginal area, it may be a sign of an infection or other medical condition. Abnormal bleeding. If you experience abnormal bleeding or spotting outside of your normal menstrual cycle, it may be a sign of an infection or other medical condition. Recurring symptoms. If you have experienced recurring vaginal odor or other symptoms, it may be a sign of an underlying condition that requires medical attention. In general, if you are experiencing vaginal odor or any other symptoms that are causing concern or discomfort, it is always best to seek medical advice from a healthcare provider. They can help determine the underlying cause and provide appropriate treatment to help restore your vaginal health. How to avoid your next vaginal odor. There are several steps you can take to help prevent vaginal odor. Practice good hygiene. Keeping the genital area clean and dry can help prevent the growth of bacteria that can cause odor. Wash your genital area with warm water and a mild, unscented soap. Avoid using harsh soaps, douches, or other products that can disrupt the natural balance of bacteria in the vagina. Wear breathable clothing. Tight-fitting clothing and synthetic fabrics can trap moisture and create a breeding ground for bacteria. Wear loose-fitting, breathable clothing, such as cotton underwear and pants, to help keep the genital area dry and prevent the growth of bacteria. Use protection during sex. Sexually transmitted infections, STIs, can cause vaginal odor. Using condoms or other forms of protection during sex can help prevent the transmission of STIs. Practice safe hygiene during menstruation. Change your tampons, pads, or menstrual cups regularly to prevent the growth of bacteria. Use unscented menstrual products and avoid scented sprays, powders, or other products that can irritate the vaginal area. Use probiotics. Probiotics can help promote the growth of healthy bacteria in the vagina, which can help prevent infections and reduce odor. You can take probiotic supplements or eat foods that are rich in probiotics, such as yogurt, kefir, and kimchi. By following these steps, you can help maintain a healthy vaginal environment and reduce your risk